decided to take 5 MEP assistants from the European Parliament to Uganda, and essentially to show them what otherwise they would only hear about in meetings or would read about in reports, and that is what is actually the effect of poverty-related and neglected diseases.
Uganda has a population of 39 million, of which 50% is under 15 years old. Life expectancy is 57 years. HIV AIDS, malaria, and lower respiratory infections are major causes of premature death.
When we went to the fishing villages, I was very impressed. I was shocked by the level of both poverty that I saw, but also when we met with the community and saw how inspiring they were and how happy they were to help people change their own lives and to make their own lives change, make their own lives better, and to help the researchers. I think that was absolutely brilliant to witness.
The LAMBU and NYENDO communities are collaborating with the Medical Research Council in HIV prevention studies, including those of the International AIDS Vaccine Initiative, short IAVI, and the International Partnership for Microbicides, short IPM. The MUVUBUKA ANGANJUSE Reproductive Health Center provides free medical services to young people. Baylor, Uganda found that an HIV treatment was safe for use in children, thus helping to fight drug resistances. The Infectious Disease Institute trial built local capacities to conduct TB infant vaccine trials.
I was quite surprised that it's really high standard. It's really like European standard of these research centers, and it proves that we should really give the money from the European Union, from the European budget for them, because the researches that they are doing, they are really helpful and results are really very positive.
At the MRC Masaka, a clinical trial of IPM's Depo-Verin ring has the potential to empower women to take HIV prevention into their own hands. The IAVI UVRI Fisher Community Project prepared the grounds for future HIV vaccine trials and increases awareness of their specific health needs. UVRI, together with the Sabin Institute and the European Vaccine Initiative, showed that infections with neglected tropical diseases reduce the efficacy of HIV vaccines.
We had meeting with one of the local MEPs who would like to buy an ambulance. The cost is $30,000 just to help their community, to have basic medical support and in this community. So it's amazing to see that they don't have, for now, they don't have even basic insurance or medical coverage.
And it's not just about, fighting against these diseases that are harming people. It's also about economic development, because these diseases are harming economic development, taking people from work, or taking people out of work because they're sick or because they have to care about their families and their partners.
The European and Developing Countries Clinical Trials Partnership, short EDCTP, invested €16.3 million in Uganda under its first phase. Since 2014, Uganda is a member of the EDCTP General Assembly. Uganda spends roughly 10% of its GDP on health, and it has committed to spend 2% of its health expenditure on research.
We tend to get a bit more caught up on figures and the actual functioning of projects. We don't necessarily think always about people who are accessing those services, what you can do to make it easier for people to access, to make sure that they stay the course and they actually stay involved in these projects. How you engage with people, we don't necessarily have that angle on things all of the time. So it's really interesting from my perspective to see that side. So I think that'll help me when I'm looking at future reports and projects coming up.
I'm much more careful when dealing with such issues, because I can now project in my head what will each of the decision we make here or the proposal we make here, how will it impact the local community. Someday,